I'm a third-generation daughter of a citrus farmer from the country Victoria. So my great-grandfather, my grandfather, my dad all grew oranges and grapes, and from that sort of illustrious start, I found my way into, I guess, my first passion was science. That's what I did initially when I was, studying, and then I had the opportunity to join Pfizer about 18 years ago, and so I joined them as a rep on the road in Queensland, in Brisbane. I was a specialist rep, so my customers were psychiatrists mostly, and I did have in my bag our antidepressant and our medication for Alzheimer's disease and some other interesting medications, and it was a great way to start. I guess it's the classic pharmaceutical career. You begin carrying the bag, you have first-hand experience talking to healthcare professionals about our medicines and how they might be helpful for a patient, and then I've been really fortunate, that I work for a company that invests in the development of its people, and I've been very much the beneficiary of that. For me, I never lose sight of the fact that there's a person very much in the centre of all that we're doing, and I have an acute appreciation for the importance of thinking about what we do and the impact that will have on the person who needs those medicines. I'll share with you that both my husband and I were widowed quite some time ago. My own husband first husband died from mental health issues, and my husband, his wife passed away from a brain tumour, and that's given us a very acute appreciation for serious illness and the need to I guess think carefully about the impact that serious illness has on the person and their family, the community they're involved in. So from an industry perspective, to me, I try very hard to never lose sight of what it is that we're trying to do here. There's a person very much at the centre of this, and we have an important story to tell. We're not always the solution, but we're often part of the solution to help that person, and we should be very proud of that. It was a great privilege and honour for me to be in the role I'm in. This is a tremendous organisation. I'm obviously very passionate myself about what we're doing, but to work with the colleagues I have here at Pfizer and to be part of a broader industry that's making such a positive impact, I think it's an exciting time to be part of this industry. We're celebrating our 60th anniversary. We came from humble beginnings here in Australia. There were 6 people in the company in 1956, and from there we now have 1,700 people. Across 5 sites, a very large manufacturing footprint. We have a portfolio of medicines, just under 260 medicines in our portfolio. We manufacture for Australia, but we also manufacture and export to more than 60 countries. And if I've got my stats right, we actually, I think, produce 1 billion tablets every year. And I think the contribution economically to Australia is something in the vicinity of $2+ billion. So it's a very significant footprint from very humble beginnings. We are an industry leader, that is true, and we have had a very long association in both New Zealand and Australia working with the industry body, and I can assure you we'll continue to do so. And I'm looking forward to meeting Milt and Caitlin, and I certainly congratulate Wes on being reappointed as chair of the board. I think looking forward, I'm quite excited about where Medicines Australia is going. I think there's been some recent announcements around the evolution of the industry body, and I think it's quite an exciting time. I think it's an opportunity for us to really, strengthen the relationships we have with our key stakeholders and to help deepen the understanding of, what it is to be in the innovative medicine business and, what is important around, that conversation, and where, the role that innovative medicines play in the broader healthcare sector. I think that everywhere in the developed world, there are challenges when you're looking at, an ageing population, this increased chronicity. We all know the statistics, ageing population, increased chronicity, with many different diseases, and that tension around needing to help provide the right level of healthcare for a population and the cost pressures that puts on a system, and then we're part of that system. The medicines industry is part of that system. So how do you ensure that, we're providing the best value with the greatest impact to help improve that health outcome for patients?